Well, good afternoon, and thank you everyone for joining us today for another webinar in our series on coping with COVID. So I'm Dr. Wendy Smeltzer. I'm the National Medical Director for WELLO, our national telemedicine service, and I'm Medical Director for Enlive, our medical facility in Calgary. And we really recognize that these are quite unsettling times right now. We're dealing with a world pandemic, and it's something none of us have ever faced in our lifetimes. And really, we're experiencing and facing things that are just unknown. Since this novel coronavirus was discovered in Wuhan, China, just 14 weeks ago, it is now in almost every country in the world, has affected over 1.3 million people, and affected businesses, the global economy, and it's actually shut down schools for 90% of the world's population. There are COVID-19 cases now in all provinces in Canada and 2 of our 3 territories, and it really has changed our daily lives in ways we couldn't have imagined. With public health advisories getting more restrictive as this virus spreads, we are now finding ourselves more at home. We're unable to go to work as in past. We're unable to participate in many of the activities we previously enjoyed. We're unable to go out and visit with friends and loved ones, unable to have our children attend school, daycares, or have play dates with their friends. And generally now we're living life in a very different way, and it's very unfamiliar to us all. So this is creating not just a medical pandemic, but it's also creating a mental health pandemic as people are struggling with these changes. Anxiety and fear for our health and the health of our families or our loved ones are really becoming a reality now. And fear of the unknown is something that we're all facing as well. We're learning now how to live physically distanced and more isolated than ever before, when our natural inclination is really to be social and connected. So I'm really pleased today that we have our psychologist, Karin Klassen, who's going to help us understand some of the mental health effects of this COVID-19 and give us some insights into some ways to cope with this. Karin is a registered psychologist and works with us at our Enlive medical facility in Calgary. She specializes in the treatment of stress in all of its forms: life transitions, mood and personality disorders, addictions and chronic pains, and whatever other emotional dysregulation erupts in the course of our lifespan. And most of us never expected an eruption like this one. So Karin's going to share some of her tips on coping with these times and how to find some new positive experiences and joys that we can now deal with in our new ways. I'm amazed at some of the innovative ways people are finding now to connect during these times and support each other in observing these physical distancing measures and finding new ways to have enjoyment and pleasure in life. So we're going to ask and appeal to all of you. If any of you have found a new way to do things or have found some new experience that's really helped you through these times, we'd like you to write it to us in the Q&A box that you'll find on your webinar screen. And we're going to share some of these with the group at the end. So I'm going to turn it over to you now, Karin, and looking forward to what you have to share with us today.
Thank you, Wendy, and thank you everybody who's tuning in again, because I've done one of these before, and so I appreciate it if you're coming back, and I also welcome everybody who's new. So my specialty is stress, and so I'm gonna share a little bit about what's going on in terms of stress and what's actually going on in our brain. Because I think if we can understand a little bit better, then we understand why the strategies kind of work. We'll talk about some strategies, and I'll also tell you kind of what I'm starting to see in clinical practice, because I have quite a busy practice and I'm seeing individuals all day, every day. And so I've kind of seen a bit of a shift, and so I might be able to share some of those things with you, so you might keep your eye open about what's coming up down the pipe for you. So the first thing I wanted to talk about, and this is a bit of a review for anybody who saw my first talk, but I want everybody to know we have 2 people in our head. We have this prefrontal cortex that's really, really smart, and then we have this cave person who's kind of at the back of our head, who's kind of like, it's comprised of the hypothalamus, the hippocampus, and the amygdala. That's our fight or flight response, and that unit kind of works together to put us into fight or flight. That prefrontal cortex is this really smart, a well-developed logical part of our brain. That part of our brain has no feeling. It's really the logical part that's demonstrated by the Rodin sculpture, the thinker there. What you might be able to see on the on the right side of your screen, I'm not sure if you can see it or if our little boxes are covering it up, there's a little caveman, because that cave person, that's really what that part of our brain is really like. When they dig up skulls from 5,000 years ago, that caveman, that fight or flight response in our brain, that actually hasn't changed in 5,000 years. So it is anatomically identical to when we were kind of caveman. And so we're still using that mechanism in our brain to respond to emotional issues, even though it was designed to kind of save our bodies from like stampeding buffalo. So it wasn't designed to deal with emotional issues. However, here we are, we have this huge prefrontal cortex. 5,000 years ago, we didn't. We had a really small prefrontal cortex. So we've super evolved, become completely different as human beings. And yet the gatekeeper for all the sensory information coming into our brain is still our fight or flight response. So you see the information still comes in our brain. It still goes up through that spinal cord, and it goes through that filter of our fight or flight response before that prefrontal cortex even gets a crack at it. So we get triggered by stuff. We get triggered. That fight or flight response kind of goes, oh, wait, we're in danger, and it triggers something. And actually, if we really get triggered quite, we really go into fight or flight, it can actually shut off access to that prefrontal cortex, which sort of explains why when we're stressed, we're not really thinking logically. We kind of have fuzzy mind, because when that fight or flight, we can see it on an fMRI, those functional MRIs, where we can see the brain think, we can see that fight or flight response goes, totally fills up with blood flow, that prefrontal cortex totally depletes in blood flow, and it actually shuts off access. So we're really not in our right mind, because we're kind of being saved by this caveman part of our brain that thinks we're in danger. So it's always important to remember that we have two people in our head, and what we're really striving for is to be in an emotional scenario where we're kind of having access to that prefrontal cortex. So the next page, next slide. We talked last time about the SUD scale. That's a subjective units of distress scale. And every psychologist will have their own SUD scale. If you look them up online, there'll be a million different SUD scales. But I'm a DBT therapist, and so I also like to look for the things that bring us endorphins. So my SUD scale is 10 is meltdown, 5 is neutral, and 0 is joy. So as soon as we're in 6, we're actually in fight or flight. The second that we're not neutral and our brain detects some danger, it throws us into fight or flight. We don't feel like we're in fight or flight until we're at 8 or 9, because we have coping and resiliency skills. So we kind of, we think we go from 0 to 100, but really we don't. We're actually in fight or flight like at 6 by this scale, but we don't realize it till we're 8 or 9. But the earlier we can cut in, if I can recognize right away by reading my body, which is like a barometer, if I can read my body and tell the second I'm going into fight or flight, it's way easier for me to reverse that and bring that back down than it is for me if I'm intervening at 8 or 9. At 8 or 9, that emotional train has left the station, and it's got to hit a wall before before I can get it under control. So really, I want to strive to make sure that I'm always like calming myself down enough so that I'm 5, 6, so that I'm able to access my prefrontal cortex and can do things that make sense, as opposed to doing things that my brain is telling me to do because it wants instant gratification. It wants relief. So when I go into fight or flight, I have another part of my brain, the hypothalamus, that kicks in and goes, whoa, we got way too many chemicals in here in our body here. We got adrenaline and cortisol coursing through our veins. We're going to give you an urge. We're going to deliver you an urge to do something. So you do a behavior so that you actually purge the additional adrenaline and cortisol and get back down into this little zone where we like to run our body. So my body's going to be delivering the urges to relieve this fight or flight response. And it might say, hurl a frying pan at your partner. It might say, drink a bottle of red wine. It might say, go eat 2 Big Macs. It will give me an urge to do something so that I have some instant gratification. But those things are really not good for me in the long term. But that part of my brain, that fight or flight response, really doesn't care about the long term, just cares about the short term. So so when we kind of want to think about our emotional feelings, we want to almost like kind of start to gauge them and start to feel them. To fix them, we need to feel them. So 5 and up is kind of when adrenaline and cortisol comes through my body, but I can also feel endorphins. And endorphins, serotonin, dopamine, those are the happy drugs that I have. I have this metaphorical pantry of happy drugs that I can go to at any time deliberately and go get them in my body. And that's 4, 3, 2, 1 that brings me down to joy. So it's just as important for us to feel the things that bring us joy as the things that bring us stress. And so when patients come in to see me, I always want to get them to really use this SUD scale. It's something you can even use within your family. I have grown children now, but they grew up using the scale, so that I can call them now at university and say, how are you doing? They're going to say nothing, fine. What's going on? Nothing. They're not going to tell me anything. But if I say, what's your SUDS? They're going to tell me their SUDS. 7. 7, I think, is probably a hangover. By 9, I'm kind of concerned. I got some points. Maybe you should fly home. Maybe I need to fly out there. It's kind of a language you can almost use to talk to each other. If I'm at 8 or 9, I'm probably not being that articulate about about what's wrong, because I don't have access to that prefrontal cortex. So I've been triggered by something. I might be upset by something. I might not even be able to articulate it, or I might misassign it to something that it's really not. So even my partner, if I come home and I walk in the door and he says, hey, I got to talk to you about something. You hit the garage on the way out or whatever. If I just say, you know what, I'm 8 or I'm 9, he's going to go, okay. And we're going to leave it till we're 6 or 5, because that's when we have communication. Communication only happens when we have access to our prefrontal cortex. So this whole little unit is a really good one, just to pay attention to yourself when you feel something in your body. What's going on? Where am I in my SUDS? Kind of think about your own SUD scale, develop your own SUD scale, and kind of go, what does my 7 look like? I'm snapping at 7. By 8, maybe I'm argumentative. By 9, maybe I'm picking fights. And by 10, maybe I'm hurling frying pans. So it's kind of almost like you want to start to gauge in yourself what that kind of looks like, so that you can intervene and bring it down with some skills. Next slide. How do I know my SUDS is going up? Body sensations. My body will tell you. Your body is like CSI me. It will deliver you this data. I'm feeling warm, perspiring. I have clammy hands, pit of the stomach, feeling butterflies, constricted chest. My heart rate is increasing, headache, stomach ache, tunnel vision. Any of those kinds of things indicate that you're going into fight or flight. So before you get to the point of meltdown, your body's actually delivering you those things a lot earlier, and you can try to pick them up earlier. In terms of behavior, because maybe I'm not really noticing what's going on in my body in terms of body sensations, but I can tell by my behavior. Am I snapping at people? Am I driving aggressively? Am I being passive aggressive? Am I withdrawing? Because your SUDS can go up, and you can be the kind of person like an extrovert where it spews out, or you can turn it in on yourself and go lock yourself in your room and cry, or you can withdraw. So it's emotional dysregulation on either side. You would need to know your body best to know that. How do you know based on your behavior if you're in stress, if your stress is going up? And then also the urges to, I know that says elf-soothe, but it actually means urges to self-soothe, the instant gratification. If I'm driving home at the end of the day and my car drives itself into McDonald's, I know that my SUDS is fairly high, because it's saying we just want some instant gratification. Go eat a Big Mac, go, just eat some chips, go do something to bring that down right away. So since I know that's going up, I kind of intervene earlier and go, yeah, you know what? I can actually self-soothe in another way that doesn't have to be like that. So next page. We talked about this last time, so that's why I'm just kind of flying through it. Why can't I get out of my head right now? This is what a lot of people ask me right now. So there are people who have really good coping and resiliency skills maybe, but now they're home, all this stuff is going on, and they go, you know what? The skills that I had before are not working. I can't be mindful. I can't get out of my head. I can't let it go. I just seem to be, subsumed by these feelings. I've got Martin Scorsese up in my head making movies about things that haven't happened yet, and I'm just like wearing them. My body's going into fight or flight as if those things are true, and they're not, and I can't seem to stop this. And the reason it's doing that is because we're vulnerable. We are not safe. Our fight or flight response is engaged because it rightly senses danger, and it's doing its job. So congratulations, you would have been a caveman that survived and lived to see, another generation. If you think about that fight or flight response, it's really about saving your life. So if you're the caveman that sat there and was never in your head and you never worried about anything, well, you got eaten by a saber-toothed tiger. If you're the caveman that went, oh my gosh, this could happen, this could happen, this could happen, that's the one that survived. And that's what our brain does. So when we know that, it's a matter of almost kind of like reassuring ourselves, we're okay, we're safe. But that caveman part of our brain is engaged because probably quite rightly, we're not that safe. And so it's kind of going, okay, wait a second, alert, alert, alert. Are you paying attention to all this stuff? And we can reassure it by going, yeah, you know what, I am. I'm socially isolating. My parents are okay. Everything's okay. But that's by bringing in that prefrontal cortex and bringing in that reasoning part of our mind. The goal is to be in wise mind. And wise mind is kind of a blend of that emotional side of your brain and your prefrontal cortex, not just sort of skipping into one or the other. Next page. So this is a new skill. I haven't talked about this skill in the past. However, this is a really good skill for effective communication because we're now communicating in a different way with our partners, with our children, with our family, with our bosses, and everybody's vulnerable. So what happens when we're vulnerable? Our fight or flight response rises at a commensurate rate. So if that fight or flight, think of that caveman, that's the one that's kind of running the show out in the front. And so that's the one that's responding. And so we don't want that caveman to respond. So sometimes we kind of want to go, okay, let me step back, and I want a formula for effective communication. This is an interesting formula. It's called Dear Man. It comes from DBT skills. So I'm a DBT therapist, dialectical behavior therapy. Doesn't really matter if you don't know what that means, but cognitive behavioral therapy more goes in through the prefrontal cortex and says, I recognize that I have these dysfunctional behaviors. Let me challenge those and check the facts and change the way I'm thinking about things. And DBT therapist kind of goes in from that stress response, and it deals with that fight or flight response first so that we don't make things worse. Because if I get triggered and I rip my partner's head off, I'm like stuck 24/7 with this person in the house for the next week, and things are going to be really, really touchy. So because I know that everyone is running high right now, everyone, our bosses are like everyone is running high. So it's like, okay, is there a grid? Can I step back and put something into a formula for communication that if you put these things in here, first of all, it helps you define what's going on for you, and it also helps you communicate to the other person. So I'm just going to quickly whip through this, and I'm going to ask you guys all to try this. You can say, please pass the potatoes using Dear Man, but you can also deal with some really, really, intense and important and emotional issues using Dear Man. So you want to use as few words as possible. No more than one sentence in each of these things. You want to have, you don't want to use a lot of descriptive words, no judgment words, just the facts, like you're a reporter describing the situation, like you're a reporter explaining the situation. So D is describe the situation. Again, we're using as few words as possible. E is express how you feel. And this is how we feel, not how I feel like you're being an idiot. This is like, I feel hurt. And you want to express your vulnerability as opposed to anger. So I feel anger, you're actually expressing your response. Anger is a response. The vulnerability is I'm hurt and therefore I'm expressing it with anger. So you really want to expose the vulnerability, because when you expose a vulnerability to another person, what do? They go, oh gosh, I'm sorry. But if you expose anger to the other person, what happens? Their fight or flight response goes up. Now you're two cavemen fighting. So you want to express your vulnerability. You want to ask for what you want, and you want to be super specific here. Remember high school, we probably all learned SMART goals: specific, measurable, attainable, realistic, and timely. So this is the hardest one for most people to do, because really, if I say to my partner, listen, I need you to be more respectful of my time. Well, what does that mean? That's not specific. It's not timely. I guess he can go, okay, sure, without really knowing exactly what I'm talking about. So that the SMART goal, for ask for what you want, is a really important one. The R, reinforce why it's good for both of you. It's one thing for me to say, listen, I need you to do this, but it's another thing to say, this would be better for both of us, because then we're communicating better, and then you're understanding what I'm saying, and then our whole evening goes better. The M is be mindful, so you're not doing it when the person is doing 3 other things. No apologies, so you're not saying, oh, sorry, I know I'm being kind of whiny, but you're not taking away from what you said. You're being assertive and not aggressive. And sometimes when people are outgoing, when we're trying to be assertive, it can come off as aggressive. So it's almost kind of like you want to shake it off and make sure that what you're doing is you're sticking to your point, but you're not being aggressive. And then the N is negotiate, to kind of give some softening to let somebody save face. So I've had people use this to ask somebody to marry them. I've used this to ask for a raise. So let me just go through this as if I'm asking for a raise. So D, describe the situation. Hi, boss. It's come to my attention that Susie down the hall makes 20% more than me. Now, notice I'm not saying, listen, I was looking over her shoulder and I saw this and she didn't show me and I'm not saying any of that. I'm just saying, hey, it's come to my attention Susie's making 20% more than me. This makes me feel like I'm not part of the team. I want to be making the same as Susie. That's my ask. Reinforcing why it's good for both of us, then I'll feel like more of the team, a part of the team. You can ask me to step up my responsibilities. I can work more evenings and weekends. I'm being mindful. I'm not doing this while my boss is writing checks or, has some other crisis going on. I'm not apologizing. I'm not saying, oh, sorry, I know it's really busy and hard to run a clinic. I'm not saying any of that. And I'm not being aggressive. I'm not saying, or I quit. And negotiate is, you know what, you got some time to think, like maybe we could have a meeting and you can tell me what I need to do to be brought up to Susie's level. Or maybe you could, if we could manage this before the next quarter, that would be great. So this formula for effective communication is a great way. You can put everything in there. The person that the client that I had who asked his girlfriend to marry me was really shy. He didn't think she was going to say yes. Described the situation. We've been living together for a few years. I feel like I'd like to move this to the next level. Marry me. I think we'd make a great couple and work really well as a team for the rest of our life. He's being mindful. He's not doing it just before she's writing exams or anything like that. He's not saying, sorry, I know you can do better, which is exactly how he felt. And he's not saying, or get out of my house, which of course he wouldn't. He's saying he's getting married. And the negotiators take your time to think about it. So this formula actually works super well. And sometimes if you sit down a couple of times and you go through this formula, your brain actually later just starts to automatically go back to this. So you don't always have to, like, every time you think, okay, I'm going to have this ask, I've controlled my suds, I've brought my level down, I need to ask my boss this, or I need to relay this thing to my boss. I want to put it in this way so my boss really understands what exactly I'm looking for. Once you run through this a couple of times, your brain will automatically start to do it. So it's a new skill I'm just introducing on this one. It's part of the DBT skills, but I think it might work really well for us now as we're all kind of, everybody's sort of stepping on everybody's toes at home, and people at home, or my clients who are working at home are saying, well, I don't know if my boss understands what's going on for me at home. And bosses are telling me, well, I'm not sure if my employees understand that I understand. So this can be a really good way to communicate. So I just wanted to introduce that new skill this time around. Next slide. So we can override the cave person. So that fight or flight response goes into overdrive, but we can override the cave person. And a couple of ways we can do this, and you'll have seen a lot of these skills a whole bunch of other places. So I'm going to go through them fairly quickly. This is more of a reference, and we're going to go through them fairly quickly. But number one, by checking the facts. Is it true, or do I feel that way? Because feelings are not facts. So if I check the facts, what's actually happening? And what's actually happening is not what my imagination is running off with, but what's happening right here and now. My parents are safe at home. They live in cities where there's hospitals. My kids are safe in their, at their universities. They're safe, they're fine. I'm safe, I'm fine, I'm okay, we're all healthy right now. We're all following the things we're supposed to do. I'm just going to check the facts and be as much as possible with the facts here in the moment, and not think about, oh, what happens when this is over? When this is this, what's going to happen to the economy? What's happening to my finances? No point thinking about any of those things right now, because you can't do anything about them. So just check the facts and stay with the facts. Positive self-talk. Our brain will believe the things we say out loud. If you've ever said, oh, I don't want to say that out loud because I think it might be true, that's kind of true. When you say something out loud, your brain takes things out of this inbox, which is when we're thinking about stuff, and it moves it to another department of your brain that creates words. So it creates a template around those words that you're going to say or write, and it believes those things when you say them or when you write them. So positive self-talk is really good, even if you don't believe it. And you won't believe it because we're terrible at positive self-talk. We're so self-critical. We say such terrible things to ourselves. We would never say those things to other people, but we say such terrible things to ourselves, and we're so hard on ourselves that it's really like when we say something positive about ourselves, we almost don't even recognize it. Like we almost can't even accept it. So really using positive self-talk can really change the way you think about things. Creating structure for whatever we can control. One thing we know is that, beyond our house and beyond what we can actually control, we have no control. We don't know what's going to happen with this. We don't know how it's going to play out. We don't know how it's going to roll out. But what we can control is that I know I can do all the things that I'm supposed to do. I know I can wash my hand. I know I can self-isolate. I know I can do all of those practices that the great doctors at InLive and that Wendy are keeping people informed about that are best practices for the moment. So I'm just going to control whatever I can control. I'm going to create structure for my day. Instead of wandering around in my pajamas all day, I'm actually going to create, which makes me feel worse and makes me feel like things are more out of control. I'm actually going to create some structure. I'm going to go, okay, you know what? I am going to actually stick to my schedule, more or less, and I'm going to work out, and then I'm going to do 2 hours of work, and then I'm going to read, and then I'm going to do this, and then I'm going to try to create some sort of structure, even creating a to-do list, even if the to-do list is get up, make my bed, and shower. even if that's one thing on the to-do list, just so that we feel we've accomplished some things, we've created some structure, we're actually producing something, we're actually moving forward. Radical acceptance is accepting the things you can't change. So you might not like it, you might disagree with it, you might feel it's totally unjust, it might be horrible for lots of reasons, and if you can't change it in some way, we have to metaphorically put it on an ice floe and kick it off to sea. We have to get it out of our kind of our worrying mind, out of what's going on right now, and we have to let go of everything that we really can't control. I have one client who has a hard time doing this, and she has 3 daughters, so she's heard that song, Let It Go, Let It Go. She's heard it a million times and she can't stand it. And so now what she does is anytime that she starts to ruminate on something, she starts to think about it, she now must listen to that song, Let It Go, Let It Go, Let It Go, to the point where now when she starts to ruminate, all she has to do is pull up that MP3 of that song and her brain just abandons it, like, nope, nothing to see here, never mind. We're not going to ruminate about anything that we can't control. Self-care. We know this overall for mental health, that if you get your body together, generally speaking, your mental health will follow. We think that mental health is about our brain doing something, and so we have to fix this over here. If I sleep well, if I'm eating well, if I'm hydrated, if I'm exercising, those things fix the base unit of my body, which is the thing that's going to carry me through this journey. So if what's one thing I control? I can control working out. I can control what I eat. I can control drinking. Now more than any time, it's you really want to pay attention to self-care. And one thing I want to really point out here in self-care too is you want to be careful about slipping into habits that are going to be hard to break later, especially when you've got teenagers or kids at home. So things like internet addiction, gaming addiction, porn addiction, those things are really tough to break once teenagers kind of slip into I've been playing video games for 8 hours a day. Those are really hard things to break. They're based on something called variable response ratio, which is the same thing that happens when we gamble. So it's a really addictive kind of thing. But even for ourselves, I know I've got friends texting me going, well, it's 4 o'clock. It's cocktail hour somewhere. Let's open a bottle of wine, have a bottle of wine. And it's easy to do that every day at 4 o'clock. And then you kind of go, you know what? I'm slipping into some bad behaviors, and these are going to be really hard to get over in the end. You want to be busy. The busier I keep my body, the more it's distracting my brain. When I sit there and do nothing, guess what happens? My brain it's like a puppy. It just goes in and starts chewing on the table legs. If I'm busy, if I'm moving my body, if I'm doing something, then actually that hypothalamus, it's the part of my brain that keeps me walking, talking, breathing. The more that I can do with my body, the more I can distract it from paying attention to emotional issues. So be busy. Be flexible. As much as I've said create structure and everything else, we don't really know kind of what's, this is new for everybody here. As Dr. Smeltzer was saying, we don't know kind of the way this is going to roll out and how we're going to feel about this. So kind of as much as we want to create structure, we also want to be flexible and be somewhat kind of let it happen a little bit and see what happens organically rather than imposing some sort of structure. Let's kind of sort of vaguely, plot something in and then see what happens organically. Maybe your kids don't, their timeline doesn't follow the same timeline as yours does over the day. So you want to be flexible as possible. And sometimes you're just going to want to go, you know what, I just don't want to get dressed today. I just don't want to do this. And you're going to have to allow yourself not lots of self-recriminations, just allow yourself permission to just sometimes you don't do anything, and that's still okay. One thing that so I've been seeing patients at home now for 3 weeks, and so I've seen a bit of an evolution. So things change. People kind of it's kind of like fish in an aquarium or something. Maybe we get used to the size or something. So for a lot of people now, they're kind of at the front end where routine is sort of starting to get, they're starting to feel better about routine. And so now bigger things are coming out and their brain is coming up with different things for them to worry about. And it is a process. This is new. Your brain is different every day. Every day we experience new things. We have new synapses every single day. Every night we're processing. When REM sleep, that's when our brain processes. So it's going to consolidate some things. Every day we're going to have a different perspective on things. We just kind of want to let it happen. We just kind of want to let it happen, understand it's a process. How I feel yesterday is not how I'm going to feel today. Try not to resist, try not to force anything, just kind of let it flow and see where it kind of lays out naturally. Sometimes when we try to make it happen, we're kind of like pushing against the tide, and we really want to see what the tide says. Try to feel things, let things flow, and try not to force anything. Don't be hard on yourself. Talked about that. We're so hard on ourselves. We want to shift the focus at this point on what we can do, not what we can't do. So it's easy to go, well, I can't do this anymore. I can't ski. I can't backcountry ski. I can't cross country ski. I'm not seeing my friends. I can't do these millions of things. We're never going to get beyond that if we're going to focus on that. And we really have to shift to, well, what can I do? There's somebody on my Facebook page who is a real mountain person and really missing going hiking. And so he actually camped on his deck and laid out his sleeping bag and had his little lantern, and he actually camped on his deck overnight and felt cold and saw the stars, and that gave him a little bit of a fix. So it really is about being flexible, finding what you can do. Think about the pantry of endorphins. I referred to that a little bit earlier when we looked at the SUD scale and we talked that 5 is neutral, 0 is joy. We have a whole bunch of things that bring us endorphins that we can reach for at any time. Keep in mind, your brain is never going to reach for endorphins like on purpose. It's going to, other than rewarding you for giving into an urge, when we want to get endorphins, we need to reach for them deliberately, because our brain will always default to negative thinking patterns. And that's just its job, right? It's looking for threats. So it cares about things that are negative. However, we have a whole cache of things that are positive in our memory, in our lives, that we can go to at any time, and we can feel those endorphins. So in my pantry of endorphins, I have some things that are, that I can think about, and some things that are actually tangible. If I look at a picture of my kids, if I look at a picture of my dog, I can actually be filled with endorphins. I can immerse myself in that photo, and I do that by thinking about all my sensory perceptions. So if I see a picture of my dog and I think about, I know how soft his little fur is, and his name is Bisou, which is kisses in French, and he little bobs you with his little nose. I can actually think about that and actually just like feel the endorphins from that, even though he's not even here right this minute. Well, he probably is. You'll probably hear a squeaky toy in the background any minute now, but I can think about that, and I can reach that anytime and go for those endorphins, even when I'm not with my dog. You may have had endorphins just from me describing that situation, because we're a social species, and we can actually mooch endorphins off other people. So when other people tell me about the cool things they're doing, I can actually feel joy about that. I can feel the endorphins, the warm and fuzzies. We want to hold on to those and ride those like a wave. Those are the chemicals in our body that counter that fight or flight response. So we really want to reach for our pantry of endorphins and almost deliberately think about what they are. I've got ticket stubs to the Mountain Film Festival. That was a super fun night with my friends. And if I really want to bury myself in that memory, I want to think about I want to go through all 5 of my sensory perceptions. That's how my brain stores things. I can remember where we were sitting. I can remember what I was wearing. I think about everything I was seeing. I can hear my friends laugh if I really focus on it. We had popcorn in there, so I can smell the popcorn. I can really put myself into that moment by using all of my sensory perceptions. So we have that pantry of endorphins, and we can go to it anytime. Next slide. As one of the things I'm seeing in practice is that things have sort of gone from the practical to the more existential, the bigger questions. It's like, why, what happens later? These sort of bigger pictures things. And you want to keep reminding yourself that this is going to pass. This is not a permanent, even though our brain is going, oh my goodness, this is it right now. This is it. This will pass. Just like things have passed in history, things that have been terrible. We will get through this. There will be another side. We will make it through this. And so one of the things is to kind of almost like have faith. And when we talk about faith, I don't mean religious, unless that's your thing, but you can have faith in science. I have faith in science that, we have smart people in this world. Somebody is going to come up with a vaccine. Somebody's going to figure this out. We've got the best minds in the world working on this right now, all over the world. I have faith that somebody's going to figure this out. I have faith in humankind. I have faith that we're good people and that we're going to do good things for each other and that we're helping each other. I'm seeing it in my community every single day, and you probably are in your community as well. Even in the universe, it's like, you know what, I think about the mountains. They've been there, thousands of years before me. They'll be there thousands of years. The universe will unfold as it should. Whatever the thing is that you need to, tether to something, that might be bigger. If that works for you, that can be a real soothing skill. You can also create the narrative that you want for moving forward. We're uncomfortable because we don't have a neural pathway for this experience. And so our brain is going, well, this is our experience. This is our belief system about ourselves. We don't know this. discomfort can also be growth. We're going to move through this, and in, whatever many years, we're going to be telling our children, our grandchildren, our great-grandchildren about this. And it's like, we can actually create the story we want for ourselves. We don't have to let the situation whip us around. We can actually kind of go, okay, well, let me see here. There's no path to the end zone here. But how if I think of how I want that end zone to be, how I want myself to be in that end zone, what do I want it, how do I want things to be when it's over? How do I want to be when it's over? I can almost like kind of create the narrative that I want for myself moving forward. It kind of goes back to that positive self-talk as well, but it's also just really about realizing that the pen is in our hand. We get to write the story of our own life going forward. We get to pick that. We didn't get to pick this setting. We didn't get to pick this current circumstance, but we have control of our own behavior, and we can pick how we move forward. There's this Buddhist quote that I really like. You don't even have to know the destination, just face the right direction and keep moving. And we can go through that all the way through our day in terms of micro actions. Does this transaction, whether it's a conversation I'm having with somebody, something I'm eating, something I'm drinking, some behavior, does this move me forward or does this move me back? And so it's just like, you know what, I don't even know where this ends, but I'm going to face the right direction and just keep moving in the smallest possible steps. If you can't see forward, if you find that's too daunting, look inward. Go back to your own values. Look at who you are and look inward. What are your values? What are you about? What are your strengths? What are some of the things that you've gone through in the past that that have created the person that you are? You've accomplished a lot of things. You're an amazing person. You've made it this far. You have some coping and resiliency skills. If you can't see forward, rely on yourself. Rely on your own skills. And here I'm going to quote, instead of the Buddha, I'm going to quote the Lion King. Remind yourself of who you are, and believe in that, and have some strength in that. Let's see here. What else do I have going forward? The other thing, I did want to talk about the slide for more tips on mental health. So Sean, I don't know if we can throw that out there. I want to go through these resources because I think these are resources that you're not going to find in other places. So there's a million resources out there now. People will tell you all the languages you can learn online, all of the museums you can visit. I mean, I participated in a national choir on Sunday. My kids and I are going to watch a Broadway musical this next Sunday coming up. There's a million things you can do and so on. But I think here's some resources that you might not have heard of. They're excellent. U of C has a free online mindfulness course. And you can just Google it there, and it's brilliant. You can go through it. I've had clients go through it and say, this is really excellent. There's a Calgary gastroenterologist named Phil Bluestein. He was part of an original study like 20 years ago on mindfulness and Crohn's disease. And as it turns out, big study, patients who had Crohn's disease who were doing mindfulness, not only did they have fewer health issues later, they reported less pain, they needed less medications, and also they reported being happier on all the measures in life that equal happiness, because we know that there's about 20 things that equal happiness, that most people most of the time need to be happy. And so when we kind of look at those measurements, people who have mindfulness skills, they actually report happiness on those other measurements. And so now Phil Bluestein, based on that study and based on the results that he saw with his own patients, wrote a book on mindfulness, and it's free. He has it online. It's called The Mindfulness Prescription. The link is there. And it's mindfulness from a science perspective. So it's really, if you just start at the beginning of the chapter, it will tell you what's going on in your body when you're being mindful. And it will go through the chapters. It's quite a big book. It will go through the chapters, and it will take you through step by step by step. Because mindfulness is kind of one of those linear things. You almost want to achieve a aha moment kind of at this level, and then you can get to the next level and the next level and the next level. And as opposed to meditation, which I think is really tough, it's going into your head and finding some peace. Mindfulness is getting out of your head and getting right here in the moment. And that means living like a sensate focused life where I'm really experiencing things, all my sensory perceptions. Things are brighter, lighter. I'm hearing more. I'm paying attention to my sensory perceptions in the moment. I'm staying out of my head and I'm staying in the moment. If I'm in my head 30% of the time thinking about the what ifs, I'm only living 70% of my life. And I'm cheap. I want 100 cents on the dollar. So mindfulness is a great way, and Phil Blustein's book is brilliant. There's another book called What to Say When You Talk to Yourself, and that's by Shad Helmstetter. It's also free online. Shad was a psychologist in the 70s who wrote this. He had this theory that your brain will live up or down to whatever you say about it. And at that point in the world of psychology, they wanted just empirically based things. We couldn't see what was going on in the brain when you did positive self-talk. So Shad his book it was a New York Times bestseller for a while in the 70s, and then it kind of slipped because the Psych Association didn't want to back it. Fast forward 50 years, and what happens? We actually can now see in fMRIs, we can see the brain, what happens in the brain when we do positive self-talk. And as it turns out, all the things that Shad said in his book turned out to be true. And he's actually going to republish the book with the fMRI data that shows that his theory is correct. However, his original book, he's published free online. And the other thing I wanted to give you, which is I think a huge resource, DBT skills are brilliant. They're practical. That's what we've been talking about here quite a bit. I'm a DBT therapist. Marsha Linehan, who has developed DBT skills, she has published the DBT skills training, just the worksheets are online free in a huge manual. So you can go look at that, and there's a ton of skills that you can look there, and you can get them right from the source in the manual. If you do want to do DBT, there's probably, you might need to see a therapist to kind of walk you through some of the skills, but a lot of the skills in that book are pretty self-explanatory, and they're pretty practical and excellent. So I wanted to pass those resources on to you because I think you probably won't get those anywhere else. Okay, I'm done.
Oh, thanks so much, Karin. That's wonderful and a ton of great information. And I'm thinking everybody, as they're sitting home in their isolated lives now, can take many of these skills and apply them and hopefully come out a whole lot better. And first one, Karin, how can we address the fear surrounding leaving the house now?
Well, it's kind of like when it comes to the point where we're leaving the house, it's going to be exposure. Exposure is the antidote to everything in psychology. Exposure means that you just are going to have to push through. You're going to have to push through the anxiety. And when you get through, you reward yourself. Yay, good job, me. Look what I did. It was okay. I'm safe. Lots of reassurance. Just in the same way that if you were afraid of spiders, I might say, okay, here's a photograph of a spider. And you'd go, and then we talk about it, and we do some deep breathing, and we bring that down to the point where I could show you the spider, and you wouldn't do any deep breathing, or you wouldn't go into a fight or flight response. And then I'd show you video. We could take a little bit more. And so it's going to be a little bit of that when people sort of reemerge. It's going to be a little bit of exposure therapy. So it might mean that you go to the grocery store really early in the morning when there are not that many people, and you might work your way up to a mall.
Great. And how best to support a family that just lives on their own? You've got your kids at home now, you're this self-contained unit. How do we best support that situation?
So within the home, you mean? Like within our home?
I'm not sure. I think that's what they mean.
Okay.
Yeah.
If we're talking within our home, well, here's one thing you want to do, especially if you have children. You want to tell them what's going on, and you want to tell them that you have some fears too, because kids don't like things that are unknown, and they can sense stress. But it's all in presentation of self. So I might, if my kids were little and at home, I might say, okay, well, this is really weird, and this is an unusual thing, but we're all going to get through it, and we're all going to be fine. And sometimes I worry too, and it's okay to worry. And this is what I do when I worry. I am going to sing a happy song. I'm going to dance. I'm going to think about all the great things I have in my life. I'm going to get busy doing a puzzle. So it's kind of almost like you want to talk yourself through it, and make sure that you are letting your kids in on it as well, so that they're understanding what's going on, and that they understand your process too.
Absolutely. And what about supporting family members who are really stressed by isolation? So, for example, an elderly parent that normally you would interact with or visit or do errands for them, and now you can't. How do you support them?
Yes. And so one thing I suggest is actually not to talk about COVID, to actually not how are you doing? Are you doing okay? Are you feeling safe today? If we create that story becomes the lens through which they see everything. If we kind of go, okay, well, you're fine. Okay, you know what? Here's what the kids baked. Can we have your peanut butter recipe, Grandma? Okay, we're going to put you on Zoom and we're going to have dinner. So part of it is like creating some normalcy as much as possible, not over talking the fear. We are getting it everywhere. Make sure they're safe, make sure they're doing the right thing. And then sometimes it's almost like changing the channel, changing the subject, and interacting with them in as normal a way as possible. I mean, really, there's no real answer. There's no one answer where you're going to say, oh, okay, well, that worked. But sometimes just changing the subject and trying to go, yeah, that's okay. That's one part of our day and we're going to check and everything's good. Okay, so what are you eating today at the home? What are they feeding you? Are you getting some of that? Are you getting to work in the kitchen? What do you, like, whatever you can do to change the subject, change the channel, change the topic, have all the kids come in, say hi, talk, whatever you can do to kind of get as normal as possible.
Excellent, excellent advice. Somebody else who makes a comment here and a question: why do I feel more sad or alone after video chats with my friends?
Because we have loss. We have loss. We've lost a lot of things. And so we're kind of grieving. And in a way, if you can celebrate that humanness, that's actually a good sign, because you care and you know that you seek that social interaction and you want that, and you kind of want to say, you know what, it's okay to feel that way. I've lost some things, and not but, because we don't want to use but takes away from what we just said, and I feel sad and I'm happy. I just talked to that person and I can feel sad at the same time. Two things can be true at the same time and seem to be completely opposite. So acknowledging that you feel the sadness and acknowledging that you miss them, and also kind of going, okay, but you know what, that's a good thing. That means I love this person. That means I care about this person.
Excellent, great advice. So a couple of medical questions that have come in as well. So I think I won't put those on you, but I'll take those. One is from somebody who said, how do I know if I have COVID? And sadly, we actually don't often know if we have COVID or not. COVID is a coronavirus, which is one of the family of viruses that creates the common cold. And symptoms from COVID can be as simple as a minor cold. It can be a bit of a sniffle, a runny nose, a scratchy throat, a bit of a dry cough. It can be very minimal. And it could be COVID. We don't know because these people right now are not being tested to be able to tell that. Of course, when things progress and people become very ill with fever or shortness of breath or some of the other things that may end up putting them, whether it's an emergency or a screening center or whatever, then of course we get tested and we can know. So the advice now, and the reason we're seeing our public health advisory tighten up, is that we're really wanting everybody to behave as if any symptom is COVID. And then you would self-isolate. If you knew you had COVID, you wouldn't take that chance and go to a grocery store or run over and just pop in on a friend. So we're really saying now, with any symptom you have, whether it's minor cold, minor flu, that you wouldn't really be that concerned about. It's 10 days of isolation or until your symptoms have gone, whichever is first. So it's really important now that we may not know. We pretend that any of those symptoms could be COVID and we behave accordingly. And that's what our public health advisory is telling us. More questions here. Why does my brain feel fuzzy?
Fight or flight. When we're in fight or flight, what happens to our prefrontal cortex? Meow. Blood flow gets restricted, that fight or flight response goes up, and it shuts off access to the prefrontal cortex. And they actually think there's an evolutionary purpose for that, that as we evolved and got this big, huge prefrontal cortex, we couldn't have this prefrontal cortex, this really logical prefrontal cortex, kick in and go, hey, what's the speed of those buffalo? What's the angle with which I need to jump out of the way before we would be dead as a species. So as that fight or flight response goes up, and the higher the distress, right, the higher our vulnerabilities, the higher that fight or flight response completely shuts off access to that prefrontal cortex, and we lose that ability to kind of think logically and rationally.
Excellent. Another medical question is around masks. And I know there have been a lot of confusing things out in the media and confusing things we read about should we or shouldn't we wear masks. And part of it is that this virus is unknown, it's new. So there's a lot of information still being learned as we go through this process. And we have to adapt and respond to that. And initially, we know the virus transmits through droplets. It's a virus that attaches to our respiratory secretions. So we've always known that people who have symptoms, if they wear a mask, they're preventing those droplets and that virus from spreading to others. But now one thing that's emerged just really in the last week or so is that we're seeing more community spread. And what that means is these are people getting the virus who have not had any travel or contact with people with known infection. So we know now that some people may be able to shed that virus in their respiratory secretions, even when they're not sick. So just through the course of breathing, talking, laughing, There are some people either just prior to developing symptoms and that day or two before the symptoms finally manifest may shed virus, or we're even seeing some evidence that some people who have no symptoms may actually shed that virus. So the recommendations now are changing, that it may be of benefit now if you're in a situation where you're not able to easily keep that physical distance of 2 meters. We have that 2-meter guideline because we know the droplet particle and the virus are heavy and they fall to the ground or the surface within that 2-meter range. So if you're 2 meters away, even if somebody was to cough or sneeze, you would not get that into your system. So wearing a mask is all about protecting the people around you. It's not about protecting yourself, unless you're a caregiver in a hospital setting or somewhere where that person that is infected cannot wear a mask to protect you, and you have to wear a mask to protect yourself. So we're saying now that it may be of benefit in situations for people who do not have symptoms to wear a mask. And these are not medical masks. We need to keep those for the professionals that require them in those hospital settings, but a cloth mask. But if you choose to wear a mask, you need to do it correctly. You have to have clean hands putting it on, because if your hands have handled something that is contaminated and then you contaminate your mask, you're just putting that right up against your nose and mouth and you can breathe that right in. And the same if your mask gets damp. If you've been breathing for a while, your breath tends to dampen that mask, a cloth mask in particular. And then it can be a reservoir again for trapping viruses. So if you choose to wear those masks, make sure you're putting them on with clean hands and changing them frequently so that they're not damp. And then when you are taking them off, make sure you dispose of them correctly, right into a bag or something that you can then put immediately into the washing machine, but don't leave them around because they could be a reservoir for virus. So lots around masks these days, but that's kind of the latest story on masks. I want to finish off by just sharing some of these positive things that have come out and some of these ways people are finding to cope. And I'm just going to pull up a couple of things that have come in. One is that somebody has a date night with their partner every week, dress up and cook a special dinner, of course, each in their own places, and then have a video dinner together, a Zoom dinner together where, you've treated it as if it's a date night. Somebody else kind of following up almost on your story, Karin, with your friend that liked to be out in the mountains. Somebody who, with their children, they love to camp in the summertime. So they get out the tent and they put it up in the basement, turn all the lights off, make it like it's, pack up their little picnic or whatever it is upstairs and pretend to go camping. But they're camping in the basement in their tent with a flashlight and doing all the things they would do on a camping night. I know for myself personally, I'm in a choir, and we're going to try having choir practices through Zoom where we can just engage together and share in song. So there's so many of these things that we're seeing. But I'd love to know, Karin, some of the innovative things that you've seen from people.
Well, mostly just, like a lot of, doing the virtual museums, creating occasions with their families. And this is something I'm doing with my family too. It's like, what are we doing to move forward today? So we're on a group, text. And so everybody writes what they're doing to move forward. People are trying new recipes. And then we're having competitions about what food looks the best. And so we're all photographing our food. We're, like I said, we're participating in national choirs. We're watching concerts, we're watching musicals, learning languages. There's a whole bunch of different things like that. So there's things like that, but also even just like realizing that this is a very cool opportunity to know yourself better. When you get triggered, that's like a wormhole into your psyche. Back to your past, and you get to kind of like go, okay, that's information about myself that's pretty cool. Like I'm seeing people are dreaming vividly, lots more dreaming. People are calling me and going like, what is going on? I'm dreaming like crazy. We're processing every day. We're processing. Get yourself a journal and start to write down some of the things that are coming up, because sometimes the things that come up when we're under stress aren't the things that we think that are front and center. It's like stuff will come out from before that we've been sitting on, and it's like it really is an opportunity to know yourself better, to deal with some of those things. So it really is like, get a journal, start to write stuff down, use your creative side to pull all that stuff out and let it pour out.
I think that's fantastic. And, we're seeing so many of these No, even in our media now, we're starting to focus on some of the positive things that are coming out. You know, we see the people in Italy from their balconies sharing, song and music, and people that are really starting to support neighbors or getting groceries for people that they know can't get out. And we're hearing today about the companies out there, 5,000 of them, that are stepping up to help make PPE and masks and some of the protective things. So sometimes when we hit these crises, we see a lot of positives that come out, and those are the things that I think it's important to focus on, because it's very easy to go down that rabbit hole of fear. And it's been great to see some of the techniques and things that you've taught us today to help pull ourselves out of that. So I would be remiss as a physician if I didn't end this by just, first of all, I'd like to thank Karin. I mean, phenomenal information and great tools and tips, and thank you for the resources. I will make sure everybody that attended today gets a copy of those, because it looks like many of them are free and readily available. So phenomenal resources that we can all tap into. But I'd also like to just take a few minutes as a physician and really, really stress how important it is that we follow our public health advisory. These recommendations that are coming out are really, really important. And I know we are waiting for a cure and waiting for a vaccine, but it's really what we each do each and every day that is going to curb, especially the big surge in cases, and help get through this crisis without overwhelming our public health and our hospital system. So it's really important that we do stay at home. Stay at home when you can. There are some essential things, if you're well, you need to go out and do. Now make sure, if you do go out, physical distance. And that 2 meters is not just a random number. It's there for a reason. We know that's what keeps you safe and helps you prevent. The second thing is, if you're ill, it doesn't matter how minor it is. A minor sniffle, a scratchy throat, stay home, self-isolate for 10 days. It could be very mild COVID virus. You do not want to spread that to your friends, family, neighbors, anybody in your community. So stay home. If you've been in contact with somebody, even if you're well, if that person is suspected or has been ill, make sure you self-isolate that 14 days. And if you do develop symptoms in that time, then it's a longer self-isolation period, another 10 days. And if you do go out, make sure you're wearing that mask, that protective mask, keeping your social distance, and the importance of washing hands frequently. The things we touch may have been touched by somebody who transmits a virus. So we want to wash those hands on a regular basis and wash them properly and avoid touching our face. So those are the things that they sound basic. They sound like it's not going to make a difference, but those are the things we know that are making a difference. So we want everybody to stay healthy and well. And thank you, Karin, for helping us with our mental health today.
Bye, everyone.
Bye.